Everyone to the Wednesday, October 20th media briefing with the Windsor-Essex County Health Unit. We will get started. CEO Nicole Dupree will make a few remarks and then we'll get right into the media Q&A session. So Nicole.
Good morning, everyone, and thank you for joining us. We wanted to start off our broadcast by touching on vaccine and highlighting a new service available to residents of Ontario. As of this week, approximately 74% of our residents have received one dose of COVID-19 vaccine, and approximately 70% are fully vaccinated with at least 2 doses. We still have some work to do to reach our provincial average, which is at approximately 83%. There are some specific age groups where we continue to hope to see a rise in rates and increase in vaccination, specifically those between the ages of 12 and 24 years of age. As of this week, only 67% of youth 12 to 17 have been fully vaccinated, and 65.2% of those 18 to 24. We're seeing the benefits that the vaccine is having on our population locally and provincially. The vaccine is greatly reducing the negative impacts of the virus across Ontario. And we know that higher vaccination rates reduce the potential for spread of COVID-19, decrease hospitalization, and ultimately death. There are many parents and individuals who still have reservations about the vaccine, and there's a lot of important information out there, including there's a lot of information out there as well as a lot of significant misinformation about vaccination. It's important that those that have concerns get the facts about the vaccine from a trusted and reliable source. We know that sometime in the near future, vaccination will be available to a broader number of youth, including children 5 to 11. So it's important to have your questions answered to ensure that you can make informed choices. To support this, we wanted to let parents, children, and youth know about a new service available through Sick Kids, COVID-19 vaccine consult service. Parents, legal guardians, caregivers, and youth that are residents of Ontario are able to have a confidential call with a knowledgeable pediatric registered nurse from Sick Kids to have open conversation and talk through any concerns or questions they have around the COVID-19 vaccine and youth. The service allows children, youth, and their families a safe and judgment-free space to ask questions of an expert to help make an informed decision around the vaccine. If you would like to use the service, you can visit sickkids.ca/vaccine consult to book a consultation. Or if you need help booking an appointment, you can call them directly at 437-881-3505. As well, I wanted to highlight our team continues to work closely to support the High Priority Communities Initiative, and we'll be supporting a kickoff event this weekend led by the Black Physicians Association of Ontario in partnership with Ontario Health, Windsor-Essex Community Health Centre, CREST, and other local healthcare partners. This event focused on Caribbean temporary foreign worker community will bring healthcare supports, vaccination, and open conversation to the community to build trusted relationships and ensure the Caribbean community of temporary foreign workers has access to the information they need to make informed decisions. Our team has worked diligently to keep our webpage up to date with credible information. From our COVID-19 page, there is access to a large amount of information around COVID-19 vaccine, including sections on frequently asked questions and information dedicated for vaccine and youth. As well as the Sick Kids information and the Sick Kids number, residents are also obviously always welcome to call us at the health unit and to have their questions answered by our staff. Thank you, and we'll take questions.
Okay, today we'll start with AM 800.
Doctor, just in regards to the vaccination status in Windsor-Essex, I know we talked on Monday and then the numbers came out afterwards, 80%, just over 80% now for double vax. And then yesterday with the case counts, number is low. I know I asked a similar question last week, but just your message to the public when they see, I guess, the vaccination, not vaccination, sorry, cases lower than what we've been seeing. Are you hoping they don't let their guard down and obviously continue doing what we've been doing here?
Yes, I think that we should still continue with the public health measures. I think we can be. I think it's reassuring that the case counts are coming down, but I think in part the case counts are coming down because vaccinations are going up, and people are continuing broadly with the public health measures, which includes physical distancing, wearing a mask indoors, wearing a mask if you can't consistently remain 6 feet away from other people, washing your hands. All of those measures are probably contributing to keeping case counts down, and I hope that will continue as time goes on.
Thank you. That's it for now.
Any questions from CTV?
Yes, good morning. Have you already been seeing a lot of hesitation amongst parents about vaccine for children 11 and under?
So, you know, I think that's a difficult question, but, you know, we have seen some reservations and hesitancy amongst the 12 to 17 age group. So we certainly anticipate moving to a younger age group that will see, you know, similar reservations. And, you know, certainly parents will have a lot of questions as it relates to youth and their children. So I think we're just looking at our current experience and want to make sure that, you know, parents have all the information that they need, and we're here to support them, you know, before we get to that stage where their children are eligible.
Thank you. And this COVID sorry, go ahead.
Yeah, if I could just supplement that, is that I think that our current experience would indicate that there is likely to be a large population or a significant population of parents who have would want further dialogue prior to vaccinating their children. And so to that extent, I think that we can anticipate some level of reluctance in some quarters or in some communities of individuals. The key thing, though, is that we've dismissed, I think Nicole can give the exact number, or we can get the exact number, but I think we've dismissed about 300 cohorts of school children and excluded them from school. So it's particularly important to get the vaccination rates up. And I think our goal should be to get it to the same level as we have for other vaccines in schools, which is around 90%. So we got to continue to work for that goal so that hopefully we can continue to keep schools open for instruction.
Melanie, I think you're on mute.
Oh, sorry. Yes, you'd think I'd know by now. The COVID consult service, it's something that's available to parents right now, either online or over the phone?
Yeah, so you can go online, parents can go online to book an appointment. It is telephone-based consult.
Okay.
And
Great,
it is available now. I believe it was launched October 4th.
Okay, sounds good. Now, as far as the vaccination rate, do you anticipate that there will be any kind of uptick now that the travel has been loosened to the US? The travel restrictions loosened.
Well, I think that it's incumbent on people, all people to get vaccinated. And I think that perhaps the loosening in travel might increase the vaccination rate, but that wouldn't be the reason I'd recommend people get vaccinated. I think that the real goal to get vaccinated is to help yourself and to help other members of the community. If the desire to travel increases vaccination rates, I think that's also a positive item, but that would not be the only reason to get vaccinated.
Great, thank you.
Any questions from CBC?
Yes, good morning. Just following up on Rob's question, looking at the numbers this week, are you encouraged by what you're seeing, or do you think that there's still a long way to go before we can say things are, you know, under control?
Well, we are, you know, we always try to take data elements in the overall context, and I think that the burden of COVID-19 now is to the community is less than it was a few weeks ago. That being said, we still have lots of young people being dismissed from schools related to COVID-19, and we still have a large group of people that have yet not been vaccinated. That is people eligible for the vaccine over 12 and people who are under 12 who still are ineligible for the vaccine. I think there is a lot. There is still many months more. I think of work to be done to bring COVID-19 under control. So I anticipate that we'll be continuing to work towards controlling COVID into 2022.
Thank you very much.
Any questions from Blackburn?
Yes, I wanted to ask about this kickoff for this event for the Caribbean temporary foreign workers this weekend. Do we have any idea how many of that population, what the percentage in that population is that are vaxxed already?
Thanks for your question. I don't have the exact number. It is difficult, even as a community, among our workers. We don't exactly have an exact number in general of even how many workers there are in our community. We have a range. So unfortunately, I don't have the exact number, but we do know that, among certain communities, there is work that needs to be done to reach out and provide better access and education. And so this is certainly one of those groups that we are working with our community partners to help support improved access and education.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Nicole. Good morning, Doctor. Based on the local vaccine statistics by age group, it's clear that there are vaccinated parents who are not vaccinating their kids. So what is your message to those parents who think it's safe for them, it's right for them, but they're hesitant about getting their children immunized?
Well, I think that the evidence would suggest that vaccine is appropriate for all eligible people. And right now, the current guidance is that people over 12 would benefit from the COVID-19 vaccination. And I would encourage parents to look at the facts and to understand the facts before making any decision. But I think that, and I know I repeat myself, but when somebody gets vaccinated, they're helping themselves. People who are vaccinated are less likely to get sick. They're less likely to be admitted to the hospital. They're less likely to die. They're less likely to transmit COVID to other people. So vaccinating your children helps them. Vaccinating your children also helps the transmission of COVID throughout the community or diminish the transmission of COVID throughout the community. The goal is ultimately to prevent the chain of transmission, to break the chain of transmission from one person to another person to ultimately to a person who's vulnerable who might get sick and die of COVID-19. And I think approximately 450 people in this district have died of COVID-19. So I would ask parents to consider vaccinating their children, not only for their own children's sake, but also how they can participate as a family in protecting other people in the community.
Thank you.
Any additional questions from AM 800?
Just one for Nicole, not COVID related. Nicole, is there any updates in regards to the safe consumption site?
Yeah, thanks for the question. Not a non-COVID question. Yeah, we are continuing to work towards our application. So the next steps will be for us to a site has been approved by our board. We'll be working with partners on developing the plan for that site. And one of the main components of that will be, as part of the application, we'll be going to our city council for approval of that site as well. These are some of the components that are part of the applications to both the Government of Ontario as well as Health Canada for the exemption. So that's the update I have at this point, Rob. We are looking at November, a November timeframe for when we hope to go to council and seek approval.
Thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Yes. Do you know when the site will be announced publicly? Which site has been chosen for the consumption site?
Yeah, so I went to our Board of Health last month, and the site is, we had 2 sites that we had finally narrowed down to and completed a community consultation on, and we approved the site at 628 Goyu that we hope to move forward with as our site.
Okay, sorry, I think I must have missed that.
Yeah, no
Thank you.
problem.
Any additional questions from Blackburn?
Yes, you mentioned that the Sick Kids Consult started up on October 4th. Is it just gone province-wide now? I can't hear you.
Oh, Nicole, I think you're...
Oh, thanks. Sorry, I'm also on mute. I said it would be needs to be our new tagline. Sorry, I'm on mute. No, I believe it's always been available for the individuals across the province. We just, it is, fairly new, and we just think it's an important and really wonderful service to highlight. And so we thought we'd take this opportunity to promote it more broadly. And again, recognizing that we still have some, whether we say hesitancy or reserve for our youth, and knowing that at some point we'll be also looking at 5 to 11-year-olds as eligible populations for vaccination. We think it's a really just another sort of tool in our toolbox and access that parents have to, especially a pediatric professional that they can talk to openly. So yeah, it's been available, I believe, for the province since it launched. We just thought it would be something that we would want to highlight this week.
Okay, and how is the rollout for, I know you guys were planning the rollout for 5 to 11. How is that going?
So we're still in planning phases. Obviously, there's no announcement on when that specific, when that age group will officially be eligible. And so we're, along with other health units across the province, and with our local partners in particular, the hospitals and our primary care and pharmacies are in the planning phases. Health units across the province have submitted a vaccination plan to the ministry, and they're reviewing, our plan along with all other health units. And we'll have continued consultation with them just to make sure that we're ready from a capacity perspective as a community, when we get to that stage. I can say I feel very comfortable that we're in a great place in Windsor-Essex, and we do still have the Devonshire mass vaccination site, which is a great site, and we'll be able to ramp up. And I think certainly between that site, our pharmacists and our local primary care physicians, I think we should be in great position in Windsor-Essex when that time comes to vaccinate children and youth 5 to 11.
Thank you very much.
Any additional questions from the Windsor Star?
Yes, Nicole, how is the search for a new permanent medical officer of health going?
Good question. So the search continues. At this point in time, I don't have any real additional information to share other than what has already been shared. We are working with our board is working with a third-party recruitment firm just to recruit a permanent medical officer of health for our community, and that posting was up for a minimum period of a month. So it just came down actually recently, and they'll be I'm sure reviewing candidates, and we'll hear more, I hope, in the near future. But so I believe it's going well. But majority of this past month has been just the posting, being up.
Okay, thank you.
Okay, thank you, everyone. We'll see everyone tomorrow.
Thank you. Have a great day.
Bye-bye.